會嘅時間到。
Members, good morning. This is the scheduled time and we have a quorum. Let's invite the administration to come in first.
上次會議呢
We had the last meeting on the 8th of July. It was the second meeting of the Bills Committee. Members raised some issues. On the 17th of June, the Secretariat published an invitation for written submission on the Village's website, and the written submissions were to be submitted before the deadline on the 4th of July. We then received 16 submissions. CB bracket 2541/2022 bracket 01 to bracket 06 bracket 16. After the deadline, we continue to receive written submissions. We have received 22 of them. Well, Secretary, I suppose our Secretariat already forwarded almost all of them to you, albeit quite late last night, because some submissions were received late. The administration, in a moment, can give a response to the submissions. The government already provided a consolidated response to the submissions earlier. CB bracket 2680/2022 bracket 1 and CB bracket 2891/2022 bracket 02 and 3 and CB bracket 781/2022 bracket 01 to 06, etc. The government already read these submissions and provided a response. But since we've received more submissions afterwards, the administration can, in a moment, give an oral reply and supplement a written reply later. We received another consolidated response from the government in August. It seems to me that in the policy address, there are a few paragraphs touching on the issues that we're discussing, such as paragraphs 33, 34, 104, etc. So, Under Secretary for Labour and Welfare, Mr. Ho Kai-ming, perhaps you can give a reply from the government's point of view to the issues raised by members and the public. So I will now invite Under Secretary for Labour and Welfare, Mr. Ho Kai-ming, to say a few words on the submissions received and the issues raised by members last time. Thank you. In last Wednesday's policy address, which is the maiden address delivered by the Chief Executive, we already responded to a number of issues. In light of the demand for increasing manpower, the Chief Executive has proposed measures to step up training and provision of manpower in the welfare sector. Priority would be given to local workers, but a special scheme will be introduced next year to suitably import care workers and health workers in the for residential care homes in order to improve the quality of manpower in the sector. Our Bureau is ironing out details. In due course, we will brief the sector on details of the scheme. As for professional nurses in the coming 5 years, 1,700 more subsidized places will be provided for nursing courses, and upon graduation, the candidates will have to serve the sector for 3 years, together with the subsidized places already provided by universities. Starting from 2023-24 in the coming 5 years, the government will subsidize 400 more places for the enrolled nurse courses per cohort. The government will also holistically review the qualification requirements to provide career prospects. In the first half of next year, the government will engage a consultant to review the provision of health workers and care workers and their qualification requirements for taking care of for medium care to high level care institutions, so that gradually we can create favorable conditions for meeting the statutory staffing requirements in the Amendment Bill 2022. We had 2 meetings of the Bills Committee. In May and in July, we had 2 online exchange sessions with the sector, and we met with a number of council members to brief them on the amendment bill and to heed their views. In relation to issues expressed on the bill, in order to allow time for the homes to recruit sufficient manpower to meet the latest staffing requirements, the government is going to suitably relax the staffing requirements, including that for nurses. For high-level care homes, there should be at least 1 nurse and 1 health worker on duty at the same time for 8 years. We propose to delay the introduction of the requirement for 2 years. That means material date being the first anniversary of the Gazette of the Amendment Ordinance. For high care level homes with more than 60 residents, they must meet the requirement starting from the 5th year. As for health workers, there should be at least 1 nurse for homes with more than 60 residents for 13 hours. We propose to postpone the commencement date by 2 years. That means it will take effect on the 3rd anniversary of Gazette of the Amendment Ordinance. That's for high care level RCHs. In the keynote speech delivered by Presidency on the 1st of July, people would like to be better looked after when they get old, and they aspire for a better life. With the amendment bill, we seek to provide better care for those in RCHEs and RCHDs, and meanwhile, we have also heard the requests from the residential care home sector on staffing requirements. Questions are welcome. Members, if you want to ask questions, please press the button. To allow effective conduct of the meeting, members, earlier, views and issues were raised, and there are also issues raised in the public's written submissions as well. So it's time for you to ask questions on these issues, and if you have new issues you'd like to raise, please do so, and I'll try to give members more time. Questions and answers included. I'll give each member 5 minutes first. 7 members have indicated they wish to speak. Let me read out their names. In this order: Dr. Tik Chi Yuen, Mr. Ben Chen, Ms. Doreen Kong, Mr. Zhao Siu Chung, Ms. Judy Chan, Dr. David Lam, Ms. Lam So Wai, and Reverend Peter Kuhn. So 5 minutes. We start with Dr. Tik. Thank you, Chair. Once again, I'd like to give my support to this bill on improving the environment of homes and stepping up staffing requirement. And I'd like to give some encouragement to our colleagues. I see that Undersecretary and his team attended a number of electrical meetings in the past week, and I also had a number of meetings with that team to discuss the arrangements. I know that the government is proactively making an effort. I hope that the team will continue with its good work. In the past, it was difficult to meet with public officers. Now they have become more proactive, so just keep it up. Now, on the bill itself, I have some suggestions and comments. First, on staffing requirement, the policy address response to some of our requests, such as importing labor and increasing training places, and also restructuring the certain grades. I'd like to comment on some of the views. For labor importation, I think it's just a transitional arrangements. It's important to nurture local talents. I hope that after 3 years there will be a review on importation of care workers. It should not run in the long term, or it will threaten local carers' jobs. And because of cultural differences, I'd say operationally, it is difficult. Now, with severe manpower shortage, I'm not against the importation of care workers at the moment. But 3 years down the road, there should be a review so that, if need be, we can scrap the plan. For the 1,700 nurses, I think it is transitional arrangements. The navigation scheme provided new blood to the nursing sector. But after the 3-year period, most nurses would leave the care home setting due to limited prospects. So after the mandatory period, they would usually leave the residential care homes. It's only a short-term measure. So eventually, like the Undersecretary said, we need to change the manpower structure. We should not compete with the healthcare sector, because over the years we have been in no position to compete for manpower with hospitals and healthcare institutions. We need to set up a proper structure to groom our own talent. I understand that early next year the government will engage a consultant. There should not be any more delay because there is still a lot on our plate. And about the challenges and pressure put on smaller homes and institutions, it's about a change in mindset. About 500, 600 such homes will be phased out. I don't think this is desirable. The government should strive to provide more support. Now, for smaller homes, due to space constraints, if no modification can be carried out, another location should be offered to help improve the operation. The government should also provide funding to help them. Although the government says that for private homes, the government will not help them, but on Gyron technology and other areas, even if they are private institutions, the government still provides help. About the time limit for the special scheme, at the appropriate juncture, we will review the effectiveness. But I would urge members to understand that we have an aging population. There is a greater demand for residential care homes against the backdrop of a shrinking workforce. Priority should be given to local workers, but meanwhile, we'll also tap the pulse of the market so that we can attract new blood to the sector. We earlier launched the Hire and Train scheme and will continue to step up effort in this regard so that we can attract more new blood to the sector. Can you say more on support? You mentioned some 6,000 beds. May I know the government's stance about small-scale residential care homes. And the way forward, I subscribe to the views of Dr. Tick. Would like to help them upgrade and transform. We're going to provide more support because of the 5% of GFA reserved to public housing projects. There will be more homes. I hope that they will continue to devote their services to the care sector. But like the member said, we have 5,000, 6,000 beds for these 500 homes. But we cannot operate on such a small scale. It's not conducive to solving the aging problem in Hong Kong. So there should be a change of mindset. They should do more to take care of our elderly. And there are technical details to iron out. We will work it out with the Social Welfare Department, and we are collecting information from them.
All right, what about the timetable? Because if we were to give them support, I understand that you're going to do it depending on their individual circumstances. But then with regard to the timetable for them to upgrade themselves and enhance their services, will there be sufficient time for them to adapt to the new requirements? Well, with regard to the new requirement on GFA, or on individual space, well, they would only be required to comply with the 8 square meter rule 4 years after the material time. In other words, and also for the rest, they will be given 8 years. In other words, that will be counted as 9 years after the passage of the bill, and we believe that this is already a very relaxed timetable for the sector to comply with the new rules. Okay, I'm sure all of you are now clear about the requirements, assuming that this bill is passed next year. With regard to the increase in personal space to 8 square meters, and then by the time when it has to reach 9 square meters, then that would the deadline will be 2032 for the first one. For the 8-year, for the 8 square meter rule, it will be 2028, which will be the deadline. So we hope that we will give them appropriate support. Yes, Mr. Ben Chen. Chairman, I support the bill, but then in the process of the legislation, we have also received a lot of comments about the upgrading of some small to medium-sized homes and so on. We hope that not too many elders will be affected by this bill, and also for those practitioners, they should not be adversely affected, or else nobody would be willing to run such homes. And therefore, in the transitional period, we will have to ensure that there will be sufficient support, and we have to be flexible in dealing with individual cases, because initially, when we came up with the legislation on the private columbarium, well, not many of them have been able to get the license even now. So I don't want this to be the second bill experiencing the same situation. With regard to the transitional period, I have a few questions. First, with regard to EA2 upgrading to EA1, according to the sector, when they indeed want to find an appropriate premise for relocation, because the existing premises might be a bit too small, but then according to the licensing office, well, in Sha Tin, you may have the premises, but then if you'd like to move to Tai Po, that would not be permitted. So apparently, there is a rule restricting them if they want to relocate to a different district. So is that true? And also, if they'd like to upgrade from EA2 to EA1, and if they are not even able to move from one district to another district, then that would be really very hard. So does that mean that individual district would have its own requirements? Secondly, well, at the forum, well, some practitioners told us that if they were to upgrade themselves, including some small homes, if they were to upgrade to a higher grade home, then the requirement would be tremendous, because they would have to do some redecoration and so on, and fitting out would be required. Well, that can be expected. But then in terms of the petitioning and so on, if they were to apply for the license again, then basically you're telling them that they should just leave the sector, because apparently they would be treated as if they were applying for the first time. And if they were to do that again, they simply would not be able to meet all the requirements. Even their fire services facilities will not be able to meet the requirement because initially when they got the license 20 years ago, the fire safety facilities requirement were a lot different. So if they were told that they had to apply for the license again, then many of them would be so worried that they rather close the operation altogether. So you will have to reassure them so that they be rest assured that even if they upgrade themselves, their operation would not be adversely affected. Third, to be honest, upgrading would require a lot of funding. In particular, in many cases, the administration would be willing to give them subsidies, loans, and so on. So you will have to give them a chance. For example, for some smaller homes, they are not making a lot of money in any case. And if they were to put in a lot of funds in order to upgrade themselves, or if they had to wait for you to classify them as under the workplace scheme, then you would have to give them some funding, or else they simply wouldn't be able to even pay the rent. So there should be some transitional arrangement by way of loans or subsidies and so on. So that would be one form of support. So can you consider that? So these are the questions that I'd like to ask for the time being. Okay. Okay, Assistant Director and also Bureau Director. Okay, thank you, Member, for your question. With regard to the upgrading from EA2 to EA1, well, the requirement is that, well, there has always been this requirement, but then they have not been doing so in a massive scale. In fact, if they were to do that, they can do that in situ. And of course, the operator would have to be willing to do that. And all the circumstances and conditions would have to be appropriate. And of course, some homes might also take the opportunity to relocate themselves. And of course, the most important consideration is that they have, in the first place, got residents in the homes that would be prepared to move with them. And secondly, we would also have to look at the individual district in question. That is whether or not there are a lot of demands for EA1 homes. And if there are already many homes in the same district, then of course we will have to be more cautious. And therefore, well, there are only 57 EA2 homes, and therefore we are negotiating with them about the details. And we have already set aside some $70 million to assist the 57 homes, so that in the next couple of years, if they were to upgrade themselves to EA1, then they would be given some support. All right, what about the license? Just now, it said that if they were to make changes, they would have to apply for the license again, and they would also have to comply with the latest statutory requirements. And also, does the license have to be renewed? Is it a once and for all application? Because some are worried that if they have to apply for it again, then they might not be able to meet the latest requirements. So once they get the license, is it forever? And also, for the private homes, are there any special requirements if they want to relocate? So these are the 3 points that many members would like to know. Yes, just now Mr. Chen said that if they were to move from one district to another district, then of course the SWD would have to look at the demand in that particular district. Well, there aren't that many premises that can be used for RCHEs. In fact, there are just there are very few of them, and if you become choosy, then it would be even harder. Yes, we are asking for information, and of course members are free to express their views. And if it's purely a private home, then of course they would also have to find the right premises on their own. So which one of you would like to answer? So Mr. Chen or Ms. Kwan? That is Ms. Nancy Kwan might be able to help about the licensing requirements. Thank you for your question, member. With regard to the RCHEs and RCHDs license, according to the law, well, the longest licensing period would be for 36 months, and therefore for the average homes, the licensing period would be up to 3 years, and they would have to apply for a renewal of the license. For some existing homes, if they were to do some internal fitting out in order to comply with the latest statutory requirement on the per person space, it doesn't require them to do an overall fitting out for the entire home. So in certain at certain locations, they might have to do some fitting out in order to fit the latest requirements, and therefore we believe that it's not that hard. Many of them, most of them, would have no difficulty whatsoever. But then, if indeed they have genuine difficulties, then we would look at their individual circumstances to see whether or not there is a need for us to relax the requirement. For example, in some village houses, there are some homes running in village houses, and if they can do some partial fitting out, for example, if they have to do some renovation in order to comply with the disabled toilet requirement, then even if they are not able to come up with a standard toilet for the disabled, we would still be prepared to relax the rules a bit. Yes, I understand that some homes are worried, but then we would be looking at the individual circumstances and we would see what we can do. All right. On the third point, can you elaborate on moving to another district? Yes. Because not many homes are involved, only 57 of them, and we've been liaising with them individually, and we would also be prepared to give them support in order to help them upgrade themselves. That's the reason why we have already set aside $74 million. That's the recurrent expenditure that has been set aside to help them. So we'd be approaching them to see what they need so that there can be a more comprehensive plan to support them. And what about moving to another district? I think your time is already up. I've already relaxed the rule. I've already given you extra time because many members would like to ask questions, and if you have further questions, you will have to wait for another round. I'd just like to ask Mr. Chen so that he can clarify, because Mr. Ben Chen also asked about the difficulty in identifying a suitable location for the relocation. So have you done any research to see what kind of support you would have to give them? Mr. Ho, well, there aren't that many locations that are suitable for the setting up of RCHEs because our requirements are quite high, because some industrial buildings should not be, are not suitable. But then there are others that might be able to meet the requirements, and in the private market, the flexibility is even greater. So Mr. Chen referred to the situation whereby some of them would have to go to another district. We will have to take a look into those. We understand members' thinking because there are already some residents in these homes. They are not new homes, and therefore we will have to look at the individual cases to see what can be done for them. That's very important because they've already got residents using the services, and if they have to relocate, then what happens to those who already stay in those homes? So, Mr. Chen, you might want to ask in another round. Next, Ms. Doreen Kong. Ms. Doreen Kong. Thank you, Chairman. I'd like to ask about the height restriction for RCHEs because at the last meeting, I remember many members asked this. That is, right now, with regard to height restriction, it should be no more than 24 meters from the at grade level. But apparently, the administration has not relax the rule at all, because at the last meeting, many members have raised this point. The reason why we are concerned about this, we hope that the administration would deal with the individual cases specifically, because that would increase the supply of RCHEs, and the size of individual space can also be increased because with more supply, obviously they would find it easier to meet the requirement. And there are some RCHEs that would have their own fire safety facilities, for example, sprinklers and so on, and also for cooking, if they use town gas or other cooking facilities, will they be permitted to do so? And also for residents with higher mobility then can they be allowed to stay in higher floors? Because worldwide, well, apparently we have been one of the most stringent places where the height requirement is up to 24 meters only. Because in some places they would allow our CHEs so that the height restriction could be up to 45 meters. So it's double our size or double our height.
And consideration can be given based on the difference in the layouts. And I think if you can relax this requirement, you provide an incentive for private investment into residential care homes. Under Secretary, well, we will discuss these issues in a subcommittee under the panel on welfare, and the Fire Services Department also explained about the 24-meter clearance. If they meet this requirement, they will be meeting if they cannot meet this requirement, they must meet 4 additional requirements. They need to have a refuge floor. They need to, say, widen the corridor, as well as the fireman's lift. Well, I think this is not the same as our existing requirements. This will impose additional costs. We need to discuss with another bureau as well. I heard members' views. I think we all share the same objective, to allow our elderly residents to live in a safe environment. So we will further discuss with another bureau on increasing supply through relaxation of these requirements. Right, apart from fire safety, rescue is another point, and that hinges on emergency service and elderly residents' safety. As we all know, in the event of an accident, we need to have regard to the safety of the firefighters as well. So consideration will be given on a case-by-case basis. Only that it entails a huge cost, and perhaps many people will be deterred. Anyway, that's Ms. Kong's point. Mr. Chow Siu-chung. Chairman, in principle, I support the various amendments put forward by the administration. I hope that elderly people will receive better care after the bill has been passed. But I'd like to speak on manpower shortage. We're short of care workers, and there is a prevailing opinion in the community that there is no way out if we do not import labor. Dr. Lo Chi-kwong, the former bureau chief, made a lot of effort, such as increasing resources, stepping up training, etc. Still, the problem remains. But as we all know, there should be fair pay, there should be a level playing field in the market, there should be priority given to local recruitment, and only when all these options are not feasible should we turn to importing labor. In a private care home, what is the pay for a care worker? What is the work environment? Now, I talked to Under Secretary Ho many times before. In a private care home, a care worker works for 12 hours for $14,000 a month. And that's almost a fixed rate. Divided by 8 hours, that means they earn $9,300 a month. With this level of pay, we require the care worker to be skilled, to be physically fit, to be caring, to take up this job of an obnoxious nature. With this minimal pay of $9,300, how would you be able to attract young people to join the sector? Instead, has the government considered helping private homes to improve the work environment and to improve their pay condition so that they could afford to pay a bit more for local care workers? Second problem, I am perplexed. Why would private homes prefer imported labor? Under the supplementary labor scheme, it's clearly spelled out that a worker should only work for 9 hours. As for the latest median monthly income, I don't remember exactly the level, but it should be above $14,000. Now, why is it that they have to work for 12 hours? And if you apply for imported labor under the SLS, you pay $14,000 for the worker to work for 9 hours. This is unreasonable. So what exactly is the incentive behind private homes hiring imported workers? The media earlier already exposed that there are a number of reasons. It's black and white 9 hours of work, but very often care workers would work for 14, 15 hours. They may be on overtime pay, but still it's more than what is stated. And accommodation may be provided, and the private homes would deduct the cost from the workers' pay, along with other deductions. Well, I mean, not all homes are like that, but at least we have some unscrupulous operators resorting to these tricks. That's the real incentive. So before launching the special scheme, the government should do the following. We have SLS, and we import some 2,000 workers every year. And you also launch a special scheme because of the epidemic, and you imported another 3,000 workers. With this new special scheme, I don't know how many more workers will be imported. So you need to do two things. First, you need to help private care homes to improve their environment. And the conditions for imported workers should be on a par with those for local workers. It's unreasonable to pay $14,000 for just 9 hours of work. And second, can you please plug the loopholes I mentioned? Under Secretary. Chairman, I first like to respond to Mr. Chow's point. For private homes to hire imported workers, you need to abide by this pamphlet, which stipulates that a worker should only work for 9 hours a day, local or imported. The Labor Department will step up inspection, and the Labor Department will be the gatekeeper to make sure we abide by the rule. According to documentation, there should be 9 hours of work a day only. This also relates to the mode of operation of smaller homes. That is why our goal is to enhance the quality of care home operations in a general manner. Next, Ms. Judy Chan. Thank you, Chairman. This is an amendment bill on residential care homes legislation. So in principle, we support the bill with a view to improving the living environment for elderly residents. I need to commend Under Secretary Ho. The government listened to our views expressed in the previous meetings and made adjustments, in particular on staffing requirements. On the space requirement, this isn't the bone of contention, because we agree that many care homes should improve their spatial should improve the environment to meet the spatial requirement. Undersecretary today announced that the commencement date can be postponed by 2 years. I think the sector will welcome this new proposal. When they first heard about the requirement to increase nurses and care workers, they feel really helpless because they're unable to recruit sufficient manpower. The Chief Executive, Mr. John Lee, in his policy address, also put forward initiatives to improve residential care homes, such as increasing training places for enrolled nurses and to retain them in the sector for 3 years. This is our vision. This is our target. However, my question is, a regular review should be conducted. You should report to us on a regular basis whether you're able to meet the target, the manpower target. I think the sector would be interested to know as well. Of course, in reality, they would know in their recruitment effort whether this target can be met. Still, you should regularly report to the Council. Second point about the professional qualifications. I remember at the last meeting we discussed whether nurses should be tasked with all the work and whether professional training can be provided to health workers. I'd like to have a response from the Undersecretary. I'll invite the Deputy Secretary Kwok to take your question. Thank you, Chairman. Thank you, Member, for the questions about the training course for enrolled nurses starting 2017-2018. We subsidize 200 places per year for the Hong Kong Metropolitan University to operate this course. It's very popular. At one point, we had 1,900 applications, but we only had 200 places. And then in the subsequent years, we still received some 1,500 applications for 200 places. We're going to subsidize 400 places now. So we are going to. I'm sure these training places will be filled. Members are concerned whether upon graduation the candidates will stay in the sector for 3 years. Now in 2017-2018, only 6 students failed to complete the 3-year requirement. Starting next year, we require them to work for 3 years, but before that is a mandatory period of 2 years, and only 6 students failed to meet or to complete the mandatory working requirement. On enrollment and the work situation upon graduation, we can regularly report to the Council. You're talking about 400 additional places or increasing the number of places from 200 to 400. Our original plan is to provide 200 fully subsidized places until 2024-25. That means starting from that cohort, we will have 420 training places. So we're going to increase the training places from 200 to 400 next year, and there'll be additional resources to continue with this initiative for 3 years. What about the review? Are we going to conduct a review? As mentioned in the policy address, a comprehensive review will be carried out in relation to different level of care in residential care homes and different types such as RCHEs and RCHDs. The qualification of staff there and the nature of work. There is great diversity in this regard. Indeed, for some tasks, instead of having nurses take them up, somebody who has been properly trained, who has the proper qualifications, such as a health worker, could take up this task. And if this is feasible, we can delegate these tasks to health workers. For local recruits, they're usually health workers. Perhaps we can add the rung on the career ladder, senior health workers, and then nurses. So this is what we're looking at. We will explore the supporting measures.
Okay, after they've completed the review, you can then see if they'd like to do a regular review. Yes, I just hope that the timing can also tie in with the coming into effect of the bill. Well, we would only be doing that, starting from the third year, and then starting from the fifth year, the new requirement will take effect. So if we were to start this review next year, we hope that that would take about a year, but then there might be some difficulties. But then, so after the review, there will still be some time before we can enact the new legislation or do the amendment. Okay, so you do encourage them to do it faster, because the consultancy review might have to look at quite a wide spectrum of issues, including the pay and remuneration for health workers and so on. So I hope that the review can also cover these. Next, Dr. David Lam. Thank you, Chairman. Basically, I support the amendment to the bill, to the legislation. But then there are quite a few measures that would only come into effect later, some up to 8 years. I think many would find it disappointing. In particular, the medical sector would feel that with sufficient space and sufficient manpower, it's not just critical for the well-being of the residents. And I think in terms of public health, if there is any pandemic or infectious disease with sufficient space, it would help to stop the spread. And also, with regard to manpower and also on the use of technology for RCHEs, and in terms of medication or medicine, well, most of the residents will have to take medication, and therefore precision in dispensing and also in administering the medication, that would also be important, because in hospitals we would need 2 nurses to work together in dispensing drugs. But then I understand that it might be quite difficult for homes to do that. But then if you're not able to do that, then that would also have significant impact on the well-being of the elderly residents. There is a suggestion that in individual district, well, even if they are not stationed at these homes, then you should at least have a center distributing the medication, so that there would be packages distributed to individual homes, so that they would be dispensed in advance, and all they need to do is to check the names and also the identity before administering the medication to the elders. I think that should be feasible at the district level, because that's what they have been doing in hospitals. I hope that you would consider doing this. I hope that you can take it up with the Health and Hygiene Bureau. And for elders going to public hospitals, they would be having or taking back a big pack of medication for 6 months and so on. But then by the time when they go for a follow-up consultation, some of the drugs might already have expired. And therefore, if there is a drug dispensing center in the district, then that would make things easier. Because if the prescription has changed, then there would be less wastage if they can be discharged or dispensed at the district level. Also, on health workers, we've been talking about them quite a lot. And also with regard to the promotion letter for health workers, I think a lot of concerns have been expressed. But then, well, there might be duplication between the work of health workers and nurses and so on. I think they should work together, and they should complement each other in order to make the best use of manpower resources. Because sometimes it's hard to tell which job should be done by whom. is like cleansing of wounds and so on. Should it be done by a doctor or should it be done by a nurse? And in many cases, health workers would be able to assist the nurses so that nurses would be able to help improve the quality of services. Next, technology. It may not have to do with the amendment bill, but then if you can use smart technology to monitor the services, for example, to remind the elders that it's time for them to go for a follow-up consultation, it's time for them to take the medication and so on. So would you be allowing the homes to install some monitoring systems or surveillance systems so that they don't have to take the blood pressure every time, so that all the data can be entered into the system, and also iSmart and so on, e-patient record and so on, would be extending that. And of course, in these homes, they would also have to jot down the health indicators or life signs and so on. For example, their pulse rate and so on, and also their dietary habits, and also whether or not they've been they are having bowel movement regularly and so on. So I think by the time when they go for a follow-up consultation, the doctors would find such information useful. So would you also be prepared to consider this? Okay, Undersecretary. Well, on medication and drug dispensing, well, we would be taking up with HA on technology. Well, starting from September this year, private homes can apply for the Innovation and Technology Fund for application in elderly and rehabilitation care, so that they can install such facilities. Well, I'm not sure about the list, whether or not the equipment referred to by Dr. Lam is on that list. But I'm sure we can also sort it out after the meeting to see what equipment should be included. Next, Ms. Lam So-wai, I think the intention of amending the bill is good, because we'd like to help the elders improve the living environment, and the sector should also move with time in order to provide better services. And during the past week or so, I've been liaising with the sector, and I'd like to convey this to you. That is for the minimum manpower requirement, because you're going to upgrade it so that they would have to have both nurse and healthcare workers on duty for at least 13 hours. So that would require extra manpower, because they are now working on a two-shift system. So they are already running short of staff, and if you increase that requirement, then it would be even harder. So you also said that there would be a special scheme. So do you have any specific details as to when that will be rolled out next year, middle of next year, or early next year? Because under the pandemic, the situation is quite volatile. So you will have to give them advance notice so that they can get prepared. And also 1,700 enrolled nurses would be trained and so on. I think that's good because they would also have to give an undertaking that they would serve at least for 3 years. But then in the private sector, I think the pay would be a lot less. And therefore, how can you ensure that after graduation, these graduates will not just stay in the NGO, they can also go into the private market? Because in the past, there has been a very fierce competition for manpower. So if you can have a pay structure, if there is a standard pay, then between the private and the NGO sectors, the pay discrepancy will not be that big, or else in the next 3 years, most of the graduates will stay in the NGO sector, but then later on they would move to the private sector. And what about the promotion ladder? So that they can have a sense of belonging, because they have good promotion prospects. And also, some of the SMEs would think that they might now be operating in some of the old districts in Kowloon, and some of the operators are already quite old, and therefore they might not be able to afford the renovation cost of up to hundreds of thousands of dollars. So I'd like to know if you have any funding support for them, so that they can apply from those funds. Well, during the next 8 years of transitional period, will the Bureau, the department, be able to play a bigger role, so that they can help the residents to stay in homes in situ? Because while they are in their twilight years, Well, sometimes they might find it difficult to adapt to the new condition because some of them might be demented, and if they have to go to another district, they might not be able to adapt, and that would also create a lot of stress for them. So, would you give them some advice? Thank you. Well, on the first issue, I'll ask Ms. Kwan, the Assistant Director, to help. And then in the private market, I think they do have this flexibility. If they're not able to have enough manpower, we do help them. And if they're not able to afford that pay, well, as a private operator, they would also have to make a commercial decision as to how much they can afford to pay their staff. But then for nurses and the nursing requirement, we would set that as a minimum standard. And also, some private homes have also got this experience, and they have to move to another district, and we've already got experience to help them to make sure that the residents would be able to find an alternative home to stay. Yes, well, some nurses, after they've graduated, they would go into the NGO sector, and some would go to the private sector. We have got the figures for 2017, 2018, and 2018 and 19. About 1/3 of them would go to the private sector, and then about 2/3 would go to NGOs. So that would be the ratio would be 1-3. So for NGOs, they have their own requirement. They have to hire nurses. And then for private homes, apart from those who have joined our scheme, for general homes, they are not required to have nurses on duty, and therefore not many of them have nurses working for them. And therefore it's not that most of the graduates would go to the NGOs, and in fact about 1/3 of the private homes do have nurses. Yes, for the requirement of 13 hours with health workers and nurses on duty, in fact they can be there interchangeably, but then it doesn't mean that they will have to have a health worker working for some 13 hours a day. So they may have a nurse and a health worker. So the nurse might be working during the regular shift, and then some of the health workers can work on a part-time basis. Yes, Reverend Peter Kun. Yes, I'd like to thank the Bureau for their positive attitude, because they have also approached us to give us a lot of explanation in private. With regard to this bill, I think we would all be prepared to support it, because as some other lawmakers have said, basically if elderly residents can have a better living environment, and if they can get better services, and of course we would welcome that. But then we have to be realistic too, because in the course of providing the services to the elders, very often it has to do with manpower and space. And Hong Kong is one of the very few places that we have difficulties providing residential care homes for the elders because of our dense population, and also many people would prefer to take up easier jobs. And when they choose jobs, they would look at the work type and also the working environment, and whether or not is what they are interested in, and whether or not they would get a decent pay. Apparently, in Hong Kong's situation, it's not easy to meet all the requirements that I mentioned earlier. And therefore, we hope that the Bureau can think about it. Once this bill is enacted, I think it's a long road, because we face this very basic situation. We have an aging population, and gradually many more people will need to use these residential care services. In the past, the administration has been doing this by way of the workplace scheme. But then in the long run, I'm not saying that the private sector is not doing well. I think RCHEs should not be a profit-making business. So it should be about serving people, and therefore the administration will have to think about this. In the long run, you will have to ensure that private homes will be able to provide quality services. I think they also have difficulties because they are leasing private premises, and they might be forced to leave, or they might be forced to vacate, and so on. So in the foreseeable future, can you consolidate your requirements and help them? And that would also make it easier for the administration to manage the system, because you are monitoring so many homes is not an easy task at all. And also in terms of manpower, we understand that the standard requirement is that they will have to increase their manning ratio, but then you would also have to think about the manning structure. For example, is it necessary for some of the jobs to be taken up by nurses? In fact, so long as they can increase the manpower, it might already do the job. So that for certain job types, you can also include that in the job list of other workers. But then in reality, do you have that much manpower to do the jobs?
I don't think we will object to upholding a higher standard. The point is whether you have sufficient manpower. So, your response, please, Under Secretary. Ms. Kwok DS. Thank you, Chair. Well, we have government development projects which will provide more places for care homes. Is it possible to have the consolidation as mentioned by Reverend Kuhn in future projects? We'll certainly explore the option. But if it's a government subsidized home, there are standards to meet. On the other hand, if we're talking about allowing them to rent certain premises, this is a new mode of operation. We need to explore the feasibility. And like I said, a manpower review should be conducted. There should be a review on the delineation of work between nurses and health workers, and we will review the situation. Our concern is the risk entailed, because after all, we are talking about care procedures. We need to be careful. We need to tackle the issue of an aging population. Surely there will be a surge in demand for care services. Of course, today our focus is on residential care homes and the facilities. Overall speaking, this may involve not only the Labour and Welfare Bureau but other bureaus as well. A joint effort should be made to tackle the aging population and the challenges facing our society. That's for the whole. That's for the government to consider. Mr. Lee Sai-wing, Stanley Lee. I'm in strong support of improving the environment for residential care homes, and I believe that all members here share the same view. Just now, when other members put questions to the government, it seems to me that even now we don't have a clear answer, and I'm disappointed. This amendment bill poses a huge pressure on smaller scale care homes. What support does the government provide? Now you have some $70 million to support the upgrading of EA2 places to EA1 places. About the additional expenditure to be incurred by smaller homes under the amendment bill, will the government provide support to help see through? Because after all, our common goal is to improve the environment for our elderly residents. Also, another question put by the member, according to the Social Welfare Department about cross-district provision, it depends on demand. I have reservations about the statistics because of the mobility of our population. How do you keep statistics by district? And like Mr. Ben Chan said, it is difficult to find suitable locations for care homes. Just like 11-a-side football, it's difficult to find a football pitch to play matches. So I'd like to have your response, Secretary. $70 million for the upgrading of EA2 to EA1 homes. We have 500 places currently subsidized by the government in the form of EA2 places under the Enhanced Spot Place scheme. Despite their share in the care sector, they are not up to the current standard. So after they've been upgraded to EA1, because of the amount of subsidy dispersed being different, we are going to make up for the difference. So that's about $16,000-$17,000 as set up in the budget. That accounts for the total sum of $70+ million. We don't have extra provision to help private homes with the modification works. Similar to support for private institutions, we may provide funding for other areas but not for renovation. Now for board places, after standardized care assessment for the elderly, the applicants will then wait and then be allowed to choose the location of the homes. It's broadly broken down into different districts. So our objective is to buy places in areas with higher demand. Now, the member mentioned a certain case. We'll go back and give it a thought. What about not having suitable premises, buildings for residential care homes? What is the government's stance in view of the surging demand? We mentioned in the policy address that 5% of GFA will be reserved in public projects for welfare facilities such as care homes. For private developers, we're providing an extra incentive. There may be private developers who would like to construct a building to house residential care homes only. We're going to provide incentives, and we will give an account to the welfare panel early next year. We're still discussing the details. As for supporting small-scale operations, I'm not focusing on renovation only. There may be additional costs arising from a change of layout to meet the fire service requirements. Of course, I don't think renovation costs should be covered with public coffers. I'm just asking about the additional costs arising from what I mentioned. It's just like what Reverend Kuhn mentioned. We need to question whether these homes are providing care services or doing business. Now, I understand that since the small-scale operators are not building professionals, they may have difficulties. We have received requests from small home operators. We'll help them by giving them templates to facilitate their applications. We will further discuss with the small-scale home operators and will collect more information from them. Mr. Michael Look. Thank you, Chairman. Well, we're still discussing the merits of the policy, so let me just also chip in. It has to do with quality of care services. I have this job vacancy information from the Labor Department. Under the SLS, all companies which would like to import workers must first register with the Labor Department. Now, on care workers, I find this really interesting. I have this question for the Undersecretary. 9 multiplied by 2 is 18, right? Undersecretary, isn't it 24? Now here it says 9 times 2 equals 24. Of course, to run a home, you need somebody to man the place 24 hours a day. Of course, round-the-clock care is needed. Now, if you recruit a care worker here, you must have a 9-hour shift and 2 shifts per day. What about the remaining 6 hours? Under Secretary Ho, what about the remaining 6 hours? Would you like him to answer this question first? I want to ask Under Secretary Ho if he's aware of the issue. This is exactly why you can't recruit sufficient manpower. In terms of manpower planning for the home care sector, 9 times 2 equals 24. Why is it permitted by the Labor Department? This is under the government's recruitment mechanism. I'll divert to the Deputy Secretary. You're talking about care workers, 2 shifts per day. We have a code of practice for care homes, and it is stipulated that there should at least be 2 shifts per day. Now that's about care workers, but apart from care workers, there are also other staff members, cleaners, for example, in a residential care home. So you mean a cleaner can become a care worker as well? I mean, at night there should be at least 1 staff member on duty. So if need be, they can approach the supervisor or some suitable staff members. At night is the rest time for residents. Now, you talked about importing care workers. We still need a certain proportion of local care workers in a home to make it feasible. We're being pragmatic. Let me give you this example. One works for 7 in the morning to 6 p.m. and then you have a break at 12 noon, and then the second shift starts at 10 p.m. to 8 a.m. the following day. So I know what the 6-hour gap is about. For each shift, you have respectively a 1-hour break. But the 1-hour break really means that the worker will still need to be on standby in the home. And then between 2 shifts, there is a 2-hour gap. That means sometimes you need to ask a worker to work overtime without pay for 2 more hours. So like Mr. Charles Siu Chung said, in reality, it's not a 9-hour shift, it's a 12-hour shift. How would you be able to recruit sufficient workers? I think the government should address this issue of malpractice in the sector. And I have this suggestion. Between health workers and care workers, there is a big pay gap. For health workers, the situation is really bleak. For the other type, it's a 9-hour shift. The pay is better. Of course, if you are a health worker, you need to undergo training. But what about senior care worker? Just have 1 additional rank between care and health workers. One can be promoted to senior care worker after accumulating experience, so that there is a career prospect for care workers, so that they know they will get a pay hike. Will the government consider introducing these measures to retain workers? And the Secretary, we will ask the Labor Department to step up inspection, especially on the compliance of working hours requirement in care homes. About private homes, as long as they meet the statutory requirements, they are permitted to operate in the way they like. Let me give you this example. We recently launched the hire and train scheme to attract local talents. But according to a major subvented organization in Hong Kong, they joined the hire and train scheme for 1 year and then they withdrew. 10 candidates joined the sector through ERB, but 1 year down the road, only 1 remained in the sector. So they have a high success rate, and yet the wastage is so serious.
So I think many things work together to result in this shortage of manpower, but then our pay is not the main reason. We will keep it for as long as is needed, but then we have to ensure that local workers will still be able to join the sector if they want. So we will have the flexibility. Next, Mr. Lai Tong Kwok. Yes, I'd like to follow up on the medical needs of these residents because just now Dr. David Lam was very nice. He told us that if we were to take care of the health of the residents, they would have to be administered drugs punctually, and therefore he was suggesting that there should be dispensing arrangements. I understand that some homes are already computerizing everything, so that even for the dispensing and administration of drugs is all computerized. So would you be doing this in a more systematic manner so that all homes will have to join such systems so that things will be automated? So that when it comes to residents taking the medication, you don't have to worry about this. They would be given the drugs on a timely manner, and also the drugs would not be dispensed wrongly. And mention was also made about homes where they would have their life indicators checked on a daily basis. Recently, Bureau Director, I visited a private RCHE. Well, at each bed of the resident, a surveillance system would be there to measure their blood pressure and also their glucose level and so on. So everything can be done automatically. But then the thing is, the administration should be more proactive in taking up that responsibility. So you can have a standardized system for all homes, so that the homes would be able to know exactly what they are supposed to install and what they need to use, instead of just having individual homes making their own decisions. If these things are not standardized, then it would not be effective in taking care of the residents. And thirdly, recently, Professor Swan, the Bureau Director for Innovation and Technology, he came here and I asked him about the A&E department. The fact that they are so busy, that's because many residents staying in RCHEs, whenever they are not feeling well, in some cases, for those who have to be fed by nasogastric tubes and so on, if they are not fed properly, then they would have to go to the A&E department. But then their conditions are not that acute, and therefore very often they would have to wait 6-8 hours at the A&E department, and that would be a waste of manpower, and the A&E department would be stressed out. So at the time, I put it to Dr. Swan, and the HA has been doing a very good job in terms of distant consultation or remote consultation. So once the system is in place, you have enrolled nurses, and then if you can develop that remote consultation system well enough, then you don't have to take the elder to the A&E department every time when they are not feeling well. So they can just stay in situ. And then you can use the remote consultation system, and then you know exactly whether or not they need to be hospitalized. Or else, given the precision dispensing and drug administration system, they would be given the right medication at the right time. But then we cannot rely solely on Professor Swan to do the job. So does the HA agree to that? And also, for those responsible for running these homes, so do all the departments concerned agree to this approach? Well, I think this is the right time for us to comprehensively look at these matters. If we are able to have a remote consultation at the elderly homes, then residents' health will be further safeguarded. And then for the Health and Hygiene Bureau, they would also be able to ease the pressure on the HA. I think it's a win-win situation. So what's your take on this, Bureau Director? Well, I'll invite Ms. Kwok to answer. Well, making better use of technology in providing services at the care homes. Well, as you said, we have the Innovation and Technology Fund for application in elderly and rehabilitation care. In fact, all homes are welcome to apply, and what they can procure under that fund has been set out in the list, and all the stakeholders have worked together, and they have agreed on this list. So they can just lease the equipment, or they can just procure the equipment. And then for the newly built homes, for example, in the new territories, we're going to have a few more new homes. And we would also be making use of the Giro Technology Fund to help them. So more space will be made available so that they can also install such equipment. For example, we use remote installation of devices to check their life indicators. We don't have to walk around the premises to measure their pulse rate or their blood pressure and so on. So if we can have such surveillance system in place, and in appropriate homes, we will be installing such facilities. And also, we also have AI robots that can chat with the residents. We will test these devices, and where appropriate, we would invite NGOs and private homes to install such technology devices. Next, Ms. Wong. Thank you, Chairman. Thank you, Member, for your questions. Well, residents' health is our main concern, and therefore, in the past, for subvented homes, well, we have got visiting doctors to visit them, and starting from October 2018, all private homes, whether they are RCHEs or RCHDs, we do have the visiting doctors scheme, whereby doctors would go there on a weekly basis, and visiting doctors would go to each and every home, and on average they go there twice a week to see the residents to make sure that they are healthy. So that would also ease the pressure on the public healthcare system, and that service is still continuing. So it's been regularized. And then for dispensing of drugs, we do take that very seriously. So whether it's the RCHE or RCHD in the code of practice, and also in terms of drug management, there are detailed requirements. For example, they would also have to check it at least 3 times before administering it to the resident and so on. And also, we have also been working with the Department of Health and also the HA. We have already developed a guideline for drug management in homes. So they would also be encouraged to set up this management system. And we also have professional nurses going to the individual homes to see how the workflow is when it comes to drug dispensing and administration. We would also conduct regular checks to ensure that they'll be doing things properly. Yes, can I add? We have already overrun. We have already given you over 8 minutes. Okay, next. Ms. Lydian Kwok. Thank you, Chairman. What I'd like to know is about the home manager's registration scheme, because it's not very clear. Well, you talk about the material date, and they would also have to comply with that by a certain date, but then you haven't set out the date exactly. But then assuming that you have to commission this requirement, do we have enough manpower to become home managers? And if there is a sufficient number of people available, then will you consider having this prospective manager system, so that if they do not have enough manpower, then they might not be able to ensure that they would meet all the requirements, and the accountability system that we'd like to put in place may not work as desired. Next, I'm also concerned about this. That is, you talk about EA2 homes, and if they're not able to meet the requirement of 9.5 square meter per resident, then you would give them funding support so that they would be able to transform themselves and meet the upgraded requirements. But then what about homes with 60 or fewer residents? And also for those who haven't got the funding, how many are there? And also how many elderly residents are there? And if these elders are affected, and if the number is quite great, then do you have any further consideration as to what to do next? Do you have any transitional arrangements to deal with these residents and also these homes? And thirdly, just now, well, as Mr. Chen also talked about elderly homes which would like to move to a different district. You said that in the 18 districts, because the circumstances are very different and therefore there might be different considerations. But what about your assessment? So are you talking about the latest assessment, or is it about the next 5 years? Do you have the relevant figures? And if you have the figures, can you turn them over to us so that we know exactly which district has a shortfall and which district has a surplus, so that we'd like to get the full picture about the distribution of places across the territory. Bureau Director, for the first question, I'll defer to Ms. Wong. And then secondly, so the third question first, about homes that would like to move to a different district. We're talking about the bought place figure, and also the waiting time to these homes. In fact, for the number of homes, I think I've already provided the figure. So there is no district that has a huge surplus. So I think the situation is quite even. So we can give you the details later. So do give us the figures afterwards. What about the next? The second question on the assessment. So just now you said that, well, in 5 years, what is going to happen? So in terms of the assessment of need or demand, yes, in terms of the number of elderly residents or elderly people who have to go to these RCHEs. So I'll defer to Ms. Wong first. Thank you. Thank you for the question. On the home manager's registration system, indeed, this is a new system. And after the amendment, that will be introduced. So who can register as home managers? Well, we do have specific requirements. First, they have to complete the designated training courses. And they would also have to possess certain professional qualifications. My apologies, Chairman, because we are pressed for time. We know that already. Assuming that the home manager's training system is not able to tie in with our timetable, then what is going to happen? So would there be sufficient time to ensure that there would be sufficient number of people who can meet the requirements? So I'll be more precise and concise then. But right now, the material, starting from the material date, well, within 6 months from the material date, we would invite some of the serving home managers to register as home managers. For example, some of the existing managers can immediately apply. We will, of course, have to check whether or not they have completed the training courses that we have designated. In fact, in 2019, we have already introduced the 5-year training subsidy program for staff of these care homes. So for those who are already managers or who are likely to become managers, they can already apply to enroll into these courses. I can give you some figures right now. As at the end of September, we have already got over 1,100 workers at these homes who have completed these manager training program. In other words, out of the 1,100 graduates, they can immediately apply to register as home managers of these homes. And for those who haven't completed the course, what is going to happen? We have this provisional registration system. There would be a 2-year grace period before they can complete the program.
如果即係
What happens if there is a problem? Would you consider the matter on a case-by-case basis? We won't wait until that late. At this stage, we're going to urge individual care home operators to ask the staff members to attend the courses, and we'll continue to step up liaison with the homes to make sure they are aware of the new requirement. Undersecretary, would you like to take the question on EA2, EA1 as well? Sorry, let me ask this question again. It hasn't been answered. But your time is up. If you have another question, please wait for another round. Let me talk to Ms. Kwok after the meeting. I think this is a rather minor point. This is not really within the scope of this bill. This is our other existing initiative. Ms. Elizabeth Kwok. We're concerned about the impact of the bill on small to medium-sized residential care homes and also the impact on the manpower of the sector. In relation to the existing homes, the homes to be built, subvented homes, I don't think there would be a problem because you're going to achieve upgrading and transformation, and you'll make use of the R&T fund for Giant technology. I'm more concerned about the small to medium-sized homes. We have received views from these homes that they will not be able to meet your requirement, especially those operating in village house. If they say operate in a village house with only 20 places, in order to meet the 9 square meters requirement, there is no way they can expand the village house. So they could just provide fewer places, and if their income drops with fewer places, they must charge more. Will the public be able to afford these homes? Especially when we have an aging population. Unless the government's intention is really to phase out small to medium-sized homes, the government needs to find ways to help them, to tide them over. In terms of subsidy, you're not providing extra to tide them over. So the practical issue facing them is that they have space constraints. They cannot expand the village house, and they are unable to rent a bigger place. And that's their complaint. If they increase the fees, they may drive away customers. So it's a question on tiding over small to medium-sized homes so that they can meet the new requirements. They are not confident, even if you give them an 8-year transitional period. They feel that in the end of the day, they will fold up anyway at the lapse of 8 years. So are there ways to help the smaller homes? Undersecretary. Now, the problem in Hong Kong is that we have an rapidly aging population, and we expect a surge in demand for residential care homes. Like the honorable member said, if we have a 20-bed home, if we operate in such a small scale, how can we cope with the aging society if we only have fewer than 20 places in a home? I think it would be very difficult. And that is why we are providing time for the operators to adjust the mode of operation. We'd like them to operate in scale. That's the purpose of setting a long transitional period for them to mull it over. Meanwhile, we also provide help for them to turn the operation into a larger home and perhaps other supporting measures for them as well. However, if some operators insist to run a home with just 10 or a dozen places, I emphasize that by 2050 we need to meet a great demand for residential care homes. That means that we may need some 6,000 care homes if we have small homes only. We have only hundreds of homes now. So if there are operators who insist on the existing mode of operation and calling for a halt of the amendment bill, I just hope that they would understand that there is a great demand. If they're willing to change their mode of operation, we are happy to provide help. Chairman, ideally speaking, if the government could provide sufficient space against a backdrop of limited supply in Hong Kong, it's very difficult to find suitable locations. If we only have medium to large size care homes, yes, it may enhance operational efficiency, but I question whether we have sufficient space to build large homes. Does it mean that there is no room of survival for the smaller homes? In fact, we receive feedback from the public that they actually prefer smaller residential care homes because they have a personal touch and they provide better care. That's at least the views of some residents. So I understand from the government that indeed your intention is to phase out small-scale care homes and focus on large care homes. Now you have 460 homes providing 6,300 places that have yet to meet your standard. In the coming 8 years, according to you, if they would like to switch to a larger operation, they should make sure they will be able to do so in 8 years. With the 6,300 places being phased out, you must make sure there are sufficient places to replace them, or else the problem will exacerbate. Right. I think the comment is that some requirements were put in place for the homes and the places to be upgraded. I just want to supplement. We don't want to phase out these homes. We want them to be upgraded and transformed. So for the operators who would like to continue with their operation, we will do our best to help them. Members have completed the first round. I now open the floor for a second round. We have 6 members who would like to go for a second round. Dr. Teck Chi Yuen, Mr. Man Chan, Mr. Lai Tong Kwok, Ms. Lilian Kwok, Mr. Michael Look, Mr. Chow Siu Chung. We have 22 minutes until we adjourn the meeting. I will extend the meeting so that all 6 members can have a second round. Each will be given 4 minutes. Please observe the time limit. Dr. Teck Chi Yuen, 4 minutes. Under Secretary said that we don't intend to drive out smaller homes. We try to help as many as we can. We don't want the small homes to be phased out. I once visited a 20-bed home, and all residents were infected at the peak of the epidemic, all staff members as well, and they just stayed in the residential care home taking care of the 20 residents there. They didn't go home. So, Undersecretary, I just hope that you would understand the situation and please don't phase out the small homes. I think your officers at the district level know what homes are in their district, and they should visit each and every one of them, and you should tap the pulse and see if they would like to carry on or fold up. If they would like to carry on their operation, I don't think technically it's difficult. It's all about providing financial support. Undersecretary just mentioned that some are private RCHEs and it may not be financially sound to subsidize them. But you do provide subsidies to private care homes, right? Undersecretary said, you can apply for the I&T fund. For application in elderly and rehab care, and there are other ways to help elderly residents. If nothing is done, 600 places would be phased out, and it should be 6,000 places to be phased out. The policy address proposes that 6,000 places will be added, but then if you do the math, in other words, in the future there won't be any net increase in the number of places of. So I hope you will visit each and every home and try to help them solve problems. I understand you will be engaging a consultant on manpower planning and projection. And from what I heard just now, there will be a review on health workers. But another review should be conducted on frontline care workers as well. Importation of labor is not the solution in the long term. Apart from nurses, you have manpower crunch for OTs and PTs as well. So you need to review the overall manpower structure in the care sector, not just for nurses and for health workers. Right, your request is for Social Welfare Department to visit the homes. We do have this arrangements. The Deputy Secretary will explain about the 6,000 places as mentioned in the policy address and the supply of homes in the private sector. In the policy address, there will be 6,200 places to be provided. All of them are subsidized places. These new places will come from the reserved GFA in public projects, places that we're going to buy, as well as the special site scheme for welfare users. These places will be commissioned soon. Now, the member mentioned a reduction of places by 6,300. That's an estimate. Some 460 homes, according to our estimate, do not meet the minimum spatial requirement per capita, and we expect that 6,300 places will be reduced in order to meet this requirement. Meanwhile, we also have regard to the market situation. At the moment, there are 8,000 vacant places in the market. So we're not too concerned that elderly residents will be driven away from care homes, as long as adjustments are made. I just want to ask a follow-up question, just a minor point. Sorry, no more time. Next, Mr. Ben Chan, not here. Maybe next time then. Mr. Lai Tong Kwok. I'd like to pick up on Director Wong's point. Some doctors visited private homes last week, but We have 7 days a week, 24 hours a day. How many outreach doctors are needed? That's why eventually elderly residents will be sent to the A&E unit. They can't be there round the clock. Because of the existing mechanism, we're putting too much pressure on the A&E unit. You talked about monitoring of dispensing drugs, etc., but all these are passive arrangements. Meanwhile, the government imposes requirements for private homes to follow and that they'll be penalized for non-compliance. On the other hand, the government does not actively help private homes to upgrade the quality. There aren't enough measures to make sure that they can provide better services.
In the long run, if you can adopt that approach, then how can our elderly homes upgrade themselves, and how can our elderly residents get better services there, and how can our hospitals have the workload reduced? That's the reason why I said that, the IT Bureau said that they be able to help. Then why can't the two bureaus work together? So why can't you be more proactive? So it's like what the chief executive said, we have to adopt a result-oriented approach, or else things will be made even more complicated, and we will never be able to resolve the problem once and for all. Well, let me try and answer the question raised by Mr. Lai with regard to the public healthcare system and also private elderly homes. That's the whole purpose of amending the legislation. And after the amendment, there will be higher manning ratio in the homes. There will be more nurses, and we would also be reviewing the structure of these homes. And then we do not rule out working with other bureaus, including the Health and Hygiene Bureau and also the IT Bureau, in order to reduce the number of elders going to the public hospitals, and that would also ease the pressure on the public hospitals, and also reduce the need for elders to go to the A&E department for minor illnesses. So it's about managing the premises, but then what about seeing doctors, and also how technology can help? I'll be working with the two bureaus, so we'll sit down and sort out the details together. Next, Ms. Lydian Kwok. Yes, I'd like to follow up on an earlier point that I made for the smaller homes, how they can migrate to the new system and so on. Well, you already explained the situation, but then I'm still concerned. That is assuming that some 6,300 places will be gone. So what are you going to do to make up for the shortfall? You said that it's okay. We do have the confidence that we can do it. But then I can't see the timetable as to when you're going to do what. Do you have plan A, B, and C, so that the public can be rest assured that you're going to do it without adversely affecting the residents in these homes? And also, Mr. Teck Chi-yun also talked about the manning ratio of these homes. I'm also concerned about this. You said that gradually you'd be phasing out these smaller homes, and there is a high chance that these smaller homes residents will have to go to the bigger homes. But then in terms of the manning ratio, when elders go to these homes, it's hard for them to adjust, and afterwards they would have to not just adjust to the new environment, but also to the bigger homes where there are so many residents. Because in the smaller homes, it's a bit more cozy because the person-to-person relationship would be more intimate. So in terms of their mental state, will they be able to adapt? So have you done any assessment, assuming that when they move to a new home, well, let's say, how many residents will have to move to a bigger home? And also, do you have support measures in place in order to make sure that psychologically they will not be adversely affected? Well, I'd like to clarify. I never said that we'd be phasing out the smaller homes. We would want them to stay. All they need to do is to upgrade their services. Yes, some 6,000 places might be reduced. That's according to our calculation. But then at the same time, there are some 8,000 vacancies available in the sector. So please, do not be shocked by the 6,000 figure, because there is a supply of 8,000 additional places. So we cannot, we are only requiring them to do some basic renovation, and then they'll be able to meet the requirement. And also in the private market, we are not talking about the subvented sector. We are talking about some 800 places that can meet the new requirement. We are talking about new figures on that can meet the requirement. I don't understand your concern. We'll be very cautious and prudent in rolling out these measures. And therefore, we do have this 8-year grace period. So from the time of enacting the legislation, it takes 1 year before we call it the material time or material date. And then there'll be another 8 years for them to meet all the requirements. That's already a very relaxed approach. So if they are still not able to meet the requirement, then these operators will really have to think hard as to why they would find it difficult to meet the new requirement in 9 years. So I think this term of government has already agreed to adopt this 9-year grace period for these homes to meet the requirements. It's already very relaxed. Okay, do you have any figures or assessments or projections so that you can tell us exactly what the projected demand in the next 10 years and also the supply situation? Yes, I think in 2017 we have already done the forecast, so we can give you the figures. Next, Luk Chong Hong. One more question has not been answered. Sorry. About psychological counseling. Yes, elders would also have to move from one home to another, even in normal circumstances. Well, the medical social workers will talk to them to see if they have any difficulties. But then in the past, we haven't encountered any specific difficulties when it comes to elders moving to a new home. Next, Luk Chong Hong. Thank you, Chairman. I support the amendment so that RCHEs can improve their services. So please do not think that I'm dragging the feet of the enactment of this amendment bill. I'd like to follow up on this. I think there is a dilemma here because on the one hand, we hope that these homes, in particular the licensed homes, they will have to meet the minimum requirement of the administration. So with limited cost, limited fees, we hope that they can continuously improve the services. But then what can they do? So that's the dilemma. I've also collected the views from the sector and I've also talked to some of them. I think there are some tricks that you may want to know. That is recently what you're going to do is that you're going to introduce some no-frills public housing units so that you can build those units faster. So can you also do the prefabricated assembly approach so that private operators can be invited to start these homes? And then they would be prepared to give you support, and then afterwards they have more room to improve the services as well as their staff's pay. So are there any methods that you can make sure that they can comply with the requirements and at the same time we can improve the services as well as the manning ratio? Yes, Secretary, any response? Well, in some of the green belts, we are actually talking to the Development Bureau to see if there are vacant sites available. But then in the longer term, we hope that we can have some long-term homes for the elders because they are quite weak and frail, and therefore we don't want them to have to move within a very short space of time. And then for the light public housing units that you talk about, it may be suitable for the people on the waiting list for public housing, but then for elders, it may not be that appropriate. For the idea of light public housing, I just like to save cost as well as time. So can you just lease some of your sites to the private operators, and then they can start a new home? Because rental cost has taken up quite a large share in their operating costs in order to ease the pressure and reduce costs so that we can balance the situation. Because for RCHEs, Well, we are actually adopting a two-pronged approach where both the public and the private sectors can do the job. And of course, if the distribution is even, of course, that's the best. But then, unfortunately, it may not be easy to achieve that. So you can go back and think about this. Yes, as to what kind of support will be needed by the sector and how you can appropriately increase the number of places in our CHEs. Yes, we all want the government to do it, but then with limited resources, some may be feasible. We have to make sure that public money is well spent. And just now, the lawmaker made a suggestion, and I think it's out of good intention, but then it's just for the administration to consider. Is that the best approach? I'm not sure. So the administration may have to do some homework about this. Next, Mr. Chao Xiu-Tong. Thank you. Well, my question for the administration is, well, in the amendment, you talk about the number of enrolled nurses. Well, for homes with over 60 places, they have to have at least one enrolled nurse, and those homes with less than 60 residents, you will be designating a date by which time they would have to meet the requirement. I'd like to know the rationale behind this. All right, for homes with over 60 residents, then they will have to have at least one enrolled nurse. But what about those with fewer than 60 residents? Do you have a replacement package? And even for homes with over 60 residents, if they're not able to get an enrolled nurse working there, then what can they do in order to meet your requirement? Or is it that if they're not able to meet the requirement, then they will have to close down?
Or they can only meet the requirement after deducting the number from 60 places. The second question, we have $500 subsidy to care workers during the peak of the epidemic. And we all know that many applicants applied for the positions. As long as you provide sufficient incentives, there would always be those who would like to take up the work. So will the government consider providing additional subsidy for private homes to retain local workers, at least partially, even if we allow some jobs to be taken up by imported workers? And the Secretary. A special measure was introduced during the epidemic to ease the staff crunch in care homes, but in the long run, if we continue to provide subsidies in this form, this will be akin to buying places from them. We provide subsidies so that they could meet the minimum statutory requirement. Our objective is to buy 1,000 places per year. Only that in the market there aren't as many places that could meet our new requirements. For the first question, I'll defer to the Deputy Secretary. There should be one nurse on duty at least for at least 8 hours. And in the Undersecretary's opening remarks, he mentioned that an adjustment would be made after the bill has been passed. It will only come into effect 4 years after the gazettal date. That means if the bill is passed in 2023, it will come into effect in 2028. Now, we estimate that by the time the 1,700 additional training places will help us train the sufficient number of nurses. We have 150 homes not recruiting sufficient nurses at the moment. So we actually need 200 additional nurses. We believe by that time there will be a sufficient supply of nurses for the 100 plus homes to meet the requirement. As for homes with fewer than 60 residents, we consider the economy of scale and the cost of hiring a nurse to work in a home with fewer than 60 residents will be quite high. Now, the HA has community nurses. Depending on the care needs, the community nurses would visit the homes for the dressing of wounds, etc. So the work will be taken up by community nurses. And if the manpower shortage has been addressed by the time, the Secretary on Labour and Welfare will appoint a date for homes with fewer than 60 places to meet this new requirement. Second round, next one, Ms. Elizabeth Quat. Well, I don't want to further extend the meeting. So after Ms. Lillian Kwok has asked her question, Dr. Teck Chi Yun and Ms. Lillian Kwok, who would like to have a third round for the follow-up questions. I'm afraid I could only allow you to ask follow-up questions at the next meeting. So after the second round ends with Ms. Lillian Kwok with administration's reply, we will adjourn the meeting. Ms. Elizabeth Kwok. Thank you, Chair. Undersecretary, you answered my question on private care homes on a smaller scale. You said you're not going to phase them out, but indeed this will happen. Next, 6,300 places in private homes are not up to standard. That means if no change is made, we will be losing 6,300 places. You may think it's still all right. After phasing out 6,300 places, you can move the residents to the 8,000 new places. But the objective of the bill is to improve the living environment for elderly residents, for them to age in place. And for 6,300 places that we're talking about, we have elderly residents having chosen to live in these homes for a reason. You need to take a people-oriented approach. You can't just look at the figures. If you don't provide help for the private homes to upgrade and transform, 6,300 elderly residents currently living in these homes will need to be moved somewhere else. Is that the best decision? Is that the best option for them? You need to think about it. You need to put in place proper arrangements for these 6,300 residents. And about the application of technology, the technology sector is of the view that more extensive use of technology would help address the pressure on residential care home staff, and this would in turn make the job more attractive. This will improve elderly residents' living condition. With technology, we can check the vitals of elderly residents to safeguard their health. Subsidy should be provided to every home, subvented or otherwise, for them to make better use of technology. Smaller homes are in dire need of technology, but they do not have the know-how, they don't have the resources. You would like to help expand the operation of smaller homes, and in the process, you should provide more support. I know it's difficult for the government to drop this bill, having regard to all the situations. I know that you've continued to make adjustments, to make improvements, but all in all, these elderly residents in private homes also need help. More should be done. Under Secretary, I thank Ms. Kwok for her reminder that we need to put people first. Now, you talked about deducting 6,300 places and adding 8,000 places. As long as you're able to, say, combine several places in the home, you will be meeting the requirement. As for the actual operational detail, we need to further discuss with the sector. I also agree strongly with Ms. Quad that we need to deploy technology more extensively. Say if in a small home, however, the home manager is also a nurse, a health worker, and a care worker at the same time, he may not have a capacity to use technology. That is why we need additional manpower to help out. I agree with the member that technology should be deployed on a wider scale. There should not be a family-style operation. Instead, we should move towards a technology-based operation. So I hope members would consider what change we need in the future. That's all for today's meeting. I hope that the administration would address the concerns raised by members as well as the views put forward by members of the public. We need a reply from the administration, especially when the Undersecretary in his opening remarks just mentioned some fine-tuning of the arrangements and the justifications. Please give us a written reply. The next meeting will be held and will inform members of the date and time. And I know that some members would like to continue to ask questions. You may do so next time. But let me stress that you've raised your concerns and the administration has responded to your concerns. Whether or not you support the bill, we need to continue with our work. I suppose we need to have a few more meetings because the bill entails a number of ordinances. So please bear that in mind. I don't think we should dwell on the same points over and over again. After making your views heard and after the administration has given a reply, it all boils down to whether we support the administration's proposal to enhance staffing requirements and other requirements. So please take note of that. Nothing under AOB. So today's meeting is adjourned. Thank you.